Well, the pandemic's triggered a surge in demand for protective face masks as shortages hit. French President Emmanuel Macron wants French factories to start producing 10 million a week. The masks are key for frontline medical staff coming into contact with infected patients. But there's debate about their effectiveness in stopping the spread of infection amongst the general population.
Face masks. For years, they've been part of daily life for many in Asia. And now, for parts of Europe, they're about to become so too. Austria's decision to make it compulsory to wear the masks in supermarkets has sparked a debate in neighbouring Germany. The town of Jena has now become Germany's first to announce similar measures. Though given the shortage of face masks, the city has encouraged people to sew their own. It's a move largely welcomed by the residents. I think it's good. The more that's done, the better. And the more everyone does it, the sooner we'll be free of the virus. I have 6 simple masks at home, and if push comes to shove, I'll sew my own.
I think it's a good idea in principle. The problem is that there simply aren't any masks.
The World Health Organization is among those saying there's little scientific evidence showing that basic masks, once not intended for medical use, effectively prevent healthy people from catching the coronavirus. But some experts advise that they could be useful as a barrier to stop those infected from contaminating others.
Masks for nose and mouth are relevant for the protection of others. If someone is infected, then masks keep the virus droplets from flying out when someone sneezes or coughs.
Up to now, the insistence by many Western countries that the widespread use of masks is not necessary has surprised many in Asia. There, people have worn face masks for years because of air pollution. But in this pandemic, they're practically a civic duty. In Europe, that attitude is now increasingly gaining ground.
Let's hear from Dr. Alexander Edwards. He's an immunologist from the University of Reading in the UK. Welcome to DW, Dr. Edwards. What's your position on the day-to-day use of face masks by the general public during this pandemic?
I think it's a really difficult one to judge because I absolutely agree with the WHO guidelines that proper, officially tested protective equipment is absolutely essential for those people who are working with patients. But the question here is about whether you should wear just some kind of face covering at all and whether that would be helpful in day-to-day life. And unfortunately, I think that we don't have enough data to suggest one way or another.
So given that we don't have the data then, presumably you can wear them or you can not wear them, and there's no we don't know how good or bad they need to be.
Yeah, I think that's the current difficulty. I think one thing I would do, though, is that because there are shortages of personal protective equipment, such as face masks, for many frontline clinicians, I would urge people not to try necessarily to deplete supplies of the really very high quality respirators and face masks which are known to be effective, because if people in the street are wearing those, then that may mean that doctors and nurses and other healthcare workers don't have access to supplies, and that would be a really bad outcome. But in terms of people wearing some kind of face covering, even a scarf in the street, it's obviously not harmful. It's not doing anyone any harm to do that. So maybe that should be considered alongside using a handkerchief when you cough and washing your hands frequently as a general hygiene requirement.
Let's turn to the general business of this pandemic. I've seen a US estimate that a quarter of people with COVID-19 show no symptoms. How much of a concern is that?
So I think that this is the driver behind the very, very rapid spread and increase in numbers that we've seen across Europe and in the USA. The most likely explanation for that enormous acceleration is that a lot of people are spreading the virus without really realizing that they are sick. And that's why we're having these sort of rather dramatic movement restrictions, is because we can't identify every single person infected. And therefore we have to just stop everyone moving around. But the real difficulty is that the kind of studies that we need to be able to identify how many people are infected without symptoms are actually quite difficult to run, and they're actually quite time-consuming and laborious. So we'll start to see more of these studies coming out and being published, but we wait anxiously for that scientific data to really understand the situation.
So while we are in the midst of this pandemic, authorities around the world are trying to flatten the curve. If they do manage to flatten this curve of infection, what do they need to do to stop it spiking again?
That is, again, the really important question. I think that the WHO's recommendation of test becomes really important because once you have a low level of infection in a population, it becomes more realistic to restrict the movement of people who are infected whilst allowing everybody else to get back to their normal business. That will be difficult, but we are starting to learn more about how to do that and expand testing capability to make sure that when we get to that flattened curve point, that we can start coming up with safe returning to work protocols.
Good talking to you. Thank you for joining us, Dr. Alexander Edwards from the University of Reading. Let's get more from DW political correspondent Nina Haase. Welcome, Nina. How far is the rest of Germany behind Jena's example in making these face masks mandatory?
Well, nobody's stopping anybody from taking such a decision here in Germany. Of course, this decision can be taken at local level any time. But Angela Merkel will talk to the state premiers of all the federal states of Germany, 16 federal states, later this afternoon. It will probably be a topic of discussion, but one state premier, an influential one from Bavaria, has already said that he's warning against such measures because he warns of stockpiling.
Yeah, what is Germany doing to make sure that it's got enough, given that there's a global shortage of these things?
Well, of course, Germany has the same problem as all other countries, that it's trying to protect its medical workers and the people who work in key infrastructure. And there are simply not enough masks available. Of course, before the corona crisis, most of Germany's masks came from China or other countries in Asia, and that is no longer happening. So some German companies have already switched their production. Textiles firms, for example, like sportswear firms, they have switched their production to producing face masks. And on Tuesday, the finance minister said that he wants to encourage those measures and that he's working on a plan to provide some sort of a financial stimulus to those countries that decide to switch their production to producing face masks now.
And on a wider point, where is Germany now in its fight against this pandemic?
Well, the more stringent measures have been in place for just over a week now, and they're not likely to be lifted anytime soon, definitely not before Easter. And the current curve seems to suggest that the rate of infection is slowing down, and the president of the public health agency that publishes those figures actually said that he was optimistic that the measures were working, but he said it was too early to tell. And he's also warning that the mortality rate is probably going to go up in Germany as it is in other countries. It's currently at 0.8%, but it's probably not going to stay there.
OK. Nina Haase, DW political correspondent, thank you.